Peptides like BPC-157 are being used by more and more people for bone and joint injuries. In this week's Ask the Doctor video, I address a viewer's question about whether his doctor could inject a peptide into his shoulder to help it heal. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series in which I answer questions that you've left me in the comments of the videos on my channel. And this is meant for general information and educational purposes only. This is in no way meant to be medical advice, especially when we're talking about peptides, which are considered experimental by the FDA. I'm not pushing them. I'm not telling you should definitely do them. I just get so many questions about peptides for orthopedic injuries that I do want to discuss them here. Here's the question. I hurt my shoulder recently and I want to use BPC-157 to help it heal. I got it from a company online. If I take it to my doctor, could he inject it into my shoulder? All right, there's a couple things here. I've done a number of videos on this, so definitely check this out in other videos on my site. I am not a big fan of people getting peptides online from these companies. I really strongly feel, and almost all peptide experts feel this way, you should get it from somebody, a physician, prescribed from a physician knowledgeable in peptides, maybe certified in peptides, but also who prescribes it from a legitimate compounding pharmacy. Having said that, if you get it from a legitimate physician who prescribes it from a legitimate pharmacy, one, yes, doctors can inject it, but again, they're typically going to get their own from their own compounding pharmacies and inject it. I do know some physicians that do that. As far as doing your daily injections, I feel like that would probably be not something many physicians would do. That's something very easily patients could do on their own. So that wouldn't necessarily be necessary. We're just talking about a subcutaneous injection with an insulin syringe, so that's not typically needed. But as I've done other videos on this, you don't want to inject anything directly into a joint, trying to get it in between the bones and cartilage and that type of thing on your own, whether it's steroids or anything else. That you need done by a doctor because you want to do a sterile technique so you don't prevent or so you don't cause an infection into that joint. But as far as could you get a peptide online and take it to a doctor and do that, I don't know any doctors that will do that. There may be some unscrupulous doctors or even non-physicians that might do it. I think that's not a good idea for a number of reasons. Again, check that out in other videos on my website. But there are ways to potentially have a doctor inject peptides. Hopefully that is helpful for you. All right, I've written an ebook. It's called the Arthritis Solution, although the treatments I discuss in it apply to far more than just osteoarthritis. You can get that completely free. It's called the Arthritis Solution. You can get that completely free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, you can click that same link, fill out the contact form, and learn more about scheduling an appointment to see me. Also, I'd love to hear about your experience with your injury. Leave those in the comments below this video. Just understand if you leave a question for me in those comments, I can't offer you medical advice there, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.